It is well understood that we inherit half of our genetic information from our mother and half from our father. The science of decoding that genetic data has advanced leaps and bounds in the past decade, enabling us to pinpoint our ethnic heritage, explore the depths of our family tree, or weigh our risk of inherited disease.
This is my mother, Eva. She was born and raised in Gothenburg, Sweden. She was also very active, very outgoing, vivacious, beautiful woman. And she has 3 sisters. She has 2 older sisters and also a fraternal twin sister.
Eva was in her 20s when she lost her mother to cancer, just before Anna-Lisa's birth. 21 years later, at nearly the same age her mother was when she became sick, Eva got a cancer diagnosis too.
She passed away from ovarian cancer when she was 48 years old. I think about her all the time, every day.
In the years that followed, one of Eva's sisters would die from breast cancer.
My mother's cousin and her daughter also were diagnosed with breast cancer. They both have had a good outcome.
So certainly whenever we see a cluster of cancers in a family like that, the same kind of cancers in particular, it makes us think that there's something that's inherited in that family that's predisposing people with a mutation.
It's pretty clear, that we definitely have this issue in our family.
This issue is the most common cause of inherited breast and ovarian cancers. The BRCA gene mutation passed down through families in their DNA.
About 5 to 10% of breast and ovarian cancer is inherited, and of that 5 to 10%, about half is due to the BRCA1 and 2 genes.
It's a 50-50 chance that someone will inherit it from one of their parents. Could be from the father, could be from the mother. It's a roll of the dice. It's a fresh roll every child.
MedStar Health's high-risk assessment and cancer prevention program offers a unique multidisciplinary team of experts focused on treating patients at risk for any inherited disease.
So one of the unique things that we offer at the MedStar Health Cancer Network High Risk Clinic is one-stop shopping. So we offer risk assessment, but we go a step further, and we also offer personalized medical management based on that person's family history and/or genetic testing results.
We have a little term we use for patients who carry a known mutation, and we call them previvors. So they're patients who have not developed cancer, but we need to keep them abreast of the latest surveillance and screening techniques so that they never get cancer. Or if they do, we catch it extremely early at the most curable stages.
Yeah, okay, Ben, it's your turn. Pick a card.
After the birth of her second child, Anna-Lisa sought genetic testing to determine once and for all if she was a carrier of the BRCA gene. A simple blood or saliva test was all it took.
And I was a little overwhelmed, and just, hearing that it's positive is, it's shocking in a way. Even though I kind of expected it, it was still hard to hear.
She had already come in knowing that she was a BRCA1 carrier, so we knew she was at high risk for breast and ovarian cancer, but she really was struggling with, what do I do next? How do I use this information? I know I'm at high risk, but what are my options, and do I have to act right away?
Come on, Griffin.
In 2017, Anna-Lisa made the decision to undergo prophylactic mastectomy surgery and have her ovaries removed, dramatically reducing her risks of developing cancer.
I'm getting to a point where my mom got diagnosed, and the older I get, according to the statistics, the higher your risk becomes. Here I am in a situation where I have the tools and the information available to me that I could take a step and maybe mitigate this risk, for my family.
For all of the milestone life events that she missed with her mom, Anna-Lisa is shoring up her future with her husband and her children.
Wanting to make sure that I set myself up as best as I can to be here for the wedding days and the graduations and all the things that my mom missed. It was traumatizing as a child to see your parent go through that. Experiencing a loss like that at a young age is hard, and I don't want that for my children.
MedStar Health. Knowledge and compassion focused on you.